Thanks for joining us today. Welcome to the Center for State's video series on readiness. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. The Readiness Brief is intended to help child welfare agency leaders, managers, and stakeholders determine an approach to assessing readiness and understand the key factors that influence readiness. It does this by providing step-by-step guidance to examine readiness and analyze findings throughout the change and implementation process. Readiness is broken down into 3 functions or tasks. 1. Consider the factors that contribute to readiness. 2. Develop an assessment approach. And 3. Conduct the assessment and analyze findings. In this module, we will dig a little deeper into the major components of readiness introduced in Module 1. And discuss the factors that influence organizational readiness for change and implementation efforts. As a refresher from Module 1, teams can use an equation developed by a group of readiness researchers in 2015 to help them remember the 3 core components of readiness for implementation. R equals mc squared. Or said another way, readiness equals 1 part motivation and 2 parts capacity. Motivation, or the willingness or desire to change and to adopt an intervention. General or foundational capacity, the aspects of an organization's healthy functioning. And intervention-specific capacity, the human, technical, and physical conditions needed to effectively implement a particular program or practice. We're going to break down this equation and look at the factors that influence motivation, general, and intervention-specific capacity. Motivation for change is the willingness and ability of an organization and its stakeholders to make change happen, where there is value and commitment to the potential outcomes of the change effort. Motivation reflects beliefs, attitudes, and perceptions of the team members involved in change, and should be considered at both the individual and organizational level. For example, considering an individual manager's willingness and ability to take action to perform a new practice, or considering commitment of an entire organization to embark on a new path and their belief in the ability to make it happen. Individual and organizational motivation can be influenced by the current change initiative or by past experiences with change efforts. These influences may give a boost to a new effort or trigger change fatigue that reduces enthusiasm for a new intervention. Think about supporting motivation throughout an initiative. Generating buy-in for a new intervention before it is introduced and during implementation setbacks are both important ways to keep team members involved in the effort and motivation levels high. Motivation of frontline staff who may be required to change practice, to administrators and managers that must support the change, as well as key child welfare partners, community, and family members, or even private agencies who support the change effort through services, will all help sustain an intervention over time. Understanding the factors that contribute to motivation for implementation can support strategies to increase readiness. Let's look at each of the factors that influence motivation. Compatibility. Does the intervention seem compatible with existing values, beliefs, experiences, and needs? Believing an effort is compatible with the team's values, beliefs, experiences, and needs can increase individual motivation. Manageability. Do managers and staff understand the intervention and believe that they can achieve it? Understanding an intervention and believing it is doable can increase the motivation of managers and staff. Prioritization. Do the key stakeholders value the intervention and believe it is as important or more important to address than other potentially competing ones? Is change in general prioritized in the organization? When innovation is expected and supported, motivation to implement it is stronger. Relative advantage. Is there a strong belief that the proposed change is better than what is currently being done? Is it perceived to be better than the alternative? When teams can see the advantage of an initiative, motivation increases. And visibility of outcomes. Can stakeholders recognize and see the potential positive outcomes? Are there early indicators or evidence from other organizations to suggest that the intervention could be successful? Is there flexibility to pilot an intervention, to test it before rolling out widely? All of these will support buy-in for a new change effort or intervention. Understanding where an organization stands in the factors that influence motivation may prompt managers and leaders to be more willing to take manageable risks on new approaches and create the supports that increase motivation for the intervention. For example, agencies can communicate about why a new program or practice is needed, which is prioritization, offer materials and training that break an intervention into easy-to-follow steps, which is manageability, embed interventions into existing structures or practices, which is compatibility, and share data and initial successes, which is visibility of outcomes, all to build buy-in and encourage motivation. There are two types of capacity in the equation: general capacity and intervention-specific capacity. When general capacity is strong, organizations are more likely to have successful change efforts. Strong general capacity reflects an organization's ability to adapt and achieve its goals, and will impact an agency's readiness to implement any program, practice, or change. Let's look more in depth at the factors that influence general capacity. Leadership at multiple levels is a key element of how an organization operates and supports change. Does leadership foster change through their focus and attention on change initiatives and consistent allocation of resources to them? Does leadership have a strong balance of the technical skills to do the work and the adaptive skills to shift values and beliefs? Strong leadership and support to increase capacity for initiatives. Organizational innovativeness and receptivity to change. Does leadership and the organization as a whole encourage innovation and learning? Are staff receptive to trying new things to solve problems? Is there safety in taking risks and being open to critically examine the current practice to improve? Openness to change and innovation increases a team's general capacity. Culture. Does the culture of the organization, including behaviors and beliefs, support future change initiatives? Research suggests that when knowledgeable and skilled staff are engaged in decision-making and have discretion on how to conduct their work, that change efforts are more successful. Climate. How does staff feel about their work? Does the work environment support staff well-being? Climates that engage staff in perceived meaningful work with support from management and peers are more accepting of change. Resource availability and effective use. Are resources, including staff, funding, space, and equipment, used effectively? Can the agency allocate and leverage these resources to introduce and support sustaining the change efforts? Support structures. Does the agency have support structures in place for decision-making, data collection and use, CQI processes, hiring, training, and coaching, internal and external communication, and partnerships or networking? Finally, staff capacity. Are there supports to increase staff skills and expertise around understanding and applying change and implementation concepts? Research suggests that the more staff understand the process, the greater buy-in will be achieved to implement change. The second type of capacity in the R=mc² equation is intervention-specific capacity, or innovation-specific capacity, and relates to the ability to implement a particular practice or program of interest. Exploring intervention-specific capacity recognizes that an agency's needs for knowledge and skills, systems, and partnerships will differ when introducing different types of interventions. For example, an intervention for improving child well-being outcomes will require knowledge on the physical and mental health needs of children and child welfare, trauma-informed practice skills, and close partnerships with community service providers. whereas an intervention to improve child safety outcomes may require knowledge of risk and protective factors, case decision-making skills, and partnership with the courts. Let's discuss the factors that influence intervention-specific capacity. Leadership buy-in and support. Do leaders and managers support a culture and climate for implementation? Do they communicate the vision, priorities, and values of the change, connect to the new practices or programs to existing goals, and allocate the resources needed? Program champions. Are there highly visible stakeholders that have knowledge of the intervention and can gain support for moving forward with implementation of the intervention and sustainment of it over time? Intervention-specific knowledge, skills, and abilities. Does the organization have the right staff with the right skills to do the work? Implementation supports or drivers. Does the organization have foundational supports or drivers in leadership, competencies, and organization to implement and sustain change? Relationships and networks. Are there interagency and partner relationships to provide ongoing collaboration support? Are there peers and system partners that have implemented similar change to learn from? Remember, readiness is essential during all steps in the change and implementation process, but can also have an impact on other tasks within an agency. When preparing for, conducting, or analyzing findings of readiness assessments, keep the following considerations in mind. Findings from ongoing readiness assessments can be incorporated into regular monitoring and reporting for APSRs or semi-annual PIP reporting, or other reporting and monitoring such as consent decrees, settlement agreements, or agency strategic plans. Assessing readiness for organizational or foundational capacity should be completed prior to the development of large-scale or long-term improvement plans, strategic planning cycles, and an agency's CFSP. And readiness assessments for intervention-specific capacity should be completed as part of the intervention selection process, prior to the implementation of program improvement strategies, or used to select strategies that support larger or longer goals. Let's take a moment to check in on what you've learned about the factors that influence readiness for change and implementation. How does motivation influence readiness? Through compatibility with the system and individuals, manageability of the intervention, prioritization of the initiative, relative advantage over other options, and clear opportunity for outcomes. How does general capacity influence readiness? Through leadership, innovation and receptiveness, culture and climate, resources, support structures, and staff capacity. How does intervention-specific capacity influence readiness? Through individual and organizational buy-in, champions to advocate for the intervention, specific knowledge, skills, and abilities, supports to sustain the intervention, and collaborative relationships. Now, take this a step further by reviewing the reflection questions and practice exercises for Consider the Factors that Influence Readiness in your Readiness Workbook to connect what you've learned to your own experience. Up next is Developing an Assessment Approach, the third module in our series on readiness for change and implementation.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.